Hi, Alex here from Clinic Sensei. Well, it's a beautiful day here in sunny Canberra, and I can tell you that I'm at home on the weekend with my kids. This is fantastic, but I wanted to shoot this little video about a very important topic. It's something that I come across all the time in other clinicians and in other practices, and it doesn't matter whether it's Chinese medicine or massage or naturopathy or chiropractic. I see it all the time, and it's something that I think is incredibly important to make you aware of. And it's what I call patient pinching. So the patient pinch is what you do when you're a little bit worried about your patient numbers. Patient pinching is what you do when you're a little bit worried about your finances. And what it is, it's that tendency to try and hold on to a patient, to not allow them to go. Now, it seems a little bit odd. The difficulty with our industry is that we're constantly trying to do ourselves out of business. In other words, we're trying to get our patients in, we're trying to get some sense of resolution or improvement, and then we're trying to get them out the door. Not trying to get them out the door prematurely, but we're trying to fix them. That should be our ultimate goal. We should not, I believe we should not be trying to have a situation where our patients at least even feel as though they're going to need to come for treatment for the rest of their lives, every week for the rest of their lives. It's just not a good thing. So patient pinching happens when a patient actually shows recovery, or they have resolution, or they get to a point of maintenance, or they feel as though they need to leave, and for whatever reason, whichever one of those or anything else, the practitioner tries to hold on to that patient. And I think this is very dangerous, because you start to get into a little bit of an ethical dilemma here, because what we want to try and do is set up a relationship where that patient feels comfortable with us in our clinic and is comfortable coming back when they have something else that needs attention too. So this doesn't apply to patients that actually need treatment. Of course, your job, your role is to keep them in the clinic as long as you believe it's necessary. But there's a very fine line between keeping them when it's ethical and necessary, and when you flip over the other side to when you start pinching on that patient. And it's tricky, because that patient will feel it even if you don't. They will feel as though you are not necessarily taking advantage of them. They'll feel as though they're not getting the results or the care that they really need. And this can be particularly problematic when you're new in practice, or your numbers are still building, because it's very tempting to try and hold on to your patients. And I can tell you from experience that it seems strange that you would try and fix them and get them out the door. It's strange to a degree, but it's really, really important, because if you keep them hanging on when you've either got as far as you can with that patient, or when they've got resolution, then that patient is going to feel it, and they're going to walk anyway. So it's very, very important that you find that point in yourself. Just so you know, when I'm treating a patient, and from day one I'm thinking, what can I do within my strategy that's going to allow me to discharge this patient? How quickly can I discharge this patient? How quickly can I get a resolution with this particular patient? And if I bear that in mind, then I'm always going to be thinking about getting the best possible result in the quickest possible time. Look, some patients resolve after one session. Does happen. Some patients resolve after 4 or 5 sessions, and some patients will need months of treatment. But you need to find that point with each and every patient where you tick from being ethical and having efficacy to being patient pinching. And that's a difficult point to find, but you will find it in yourself. What I want you to be is aware that this can happen. Ironically, what I've found is that the sooner you create a resolution with your patient, the sooner you can discharge a patient from your continuous ongoing care with that particular condition that they initially came in, the more likely they are to refer, because you start to build a reputation for getting a fix and developing a maintenance, rather than I need to see you every week for the rest of your life. You don't want that reputation. You want a reputation as someone who does provide a healing outcome or a healing response. So I hope that makes sense. Patient pinching is one of the things I see very often. It's something that makes me very nervous. It's going to ultimately do you no favours in terms of your practice. So even while your patient numbers are relatively low or building up, don't be tempted to hang on to a patient for even a week longer than you have to. Discharge that patient when you can. And I've got to say, probably this week, I'm thinking, but probably discharged at least half a dozen patients. And nothing feels better than saying to a patient, you know what, look at where you've come from, look at where we are now. I think we're at a point where you're very happy, the condition has resolved. Consider some ongoing maintenance, perhaps quarterly, monthly. But I think we're at a point where we're ready to start to expand our treatment in terms of time frame or medication or whatever it happens to be. Nothing feels better as a practitioner to be able to say, we've done a terrific job. We'll see you when you get the next thing. And I can't emphasise that enough. So good luck with that. Have a good think about it. PP, patient pinch, don't do it. It's one of the worst things you can do for your business. Discharging your patients, having got a really good outcome, a clinical outcome, knowing when to discharge, that's going to win you a lot of business because that all goes into building your reputation. Good luck with your business, and I look forward to seeing you again at the next episode of Clinic Sensei. Take care.